Well, you see, I mean, there are many different kinds of mental illness. So it's hard to speak about mental illness as one problem. The brain is very complex, has many different elements to it, obviously. It's a seat of consciousness, seat of sentience, cognition, and so forth. There are some mental illnesses that have to do with cognition, some mental illnesses have to do with mood, some mental illnesses have to do with various other aspects of the brain. It's very important right at the top to ensure that people understand that mental illness, more than perhaps even any other illness, has an important situational, environmental, psychosocial element to it. Grief doesn't begin inside your brain. It usually begins outside and impinges on you. But then, in the case of depression, it almost becomes a self-fulfilling cycle. At least my experience of it becomes a self-fulfilling cycle, and all of a sudden you lose joy and inability to get outside grief. Even while respecting or understanding the idea that there are psychosocial, environmental, and other influences, genetic influences to mental illness, ultimately, in the case of depression, it's a dysregulation of mood. And there are neurons, neuronal circuits, neurohormonal circuits in the brain that are responsible for the maintenance of mood, for the capacity to obtain joy. And it's very important then to understand that depression is not just a cellular illness, but there is a cellular component to it. That cells are involved, cells and circuits of cells are involved, and in order to, once we understand that, actually it helps. I think it demystifies and destigmatizes depression as an illness. And once you demystify and destigmatize it, because you now located it in the body, you've located it in cells, while you haven't denied the idea that it might come, that there may be situational modifiers or situational events. And therefore, you then can think about potentially treating and solving depression using not just behavioral therapy, not just talk therapy, as they call it, but also using medicines, also using other modalities, more recently, as I describe in the book, deep brain stimulation and other kinds of modalities. I think this whole process of identifying this depression as having a cellular component to it is very important because of the stigma attached to the disease otherwise. So, no one tells, people say, why don't you snap out of your depression? But no one says, why don't you snap out of your cancer? Why don't you snap out of your diabetes? And that's because they think of one as something that you've created yourself. You blame the victim, whereas they think of the other as something that your body is doing. So one of my challenges and one of my purposes in writing about mental illness was to really remind people that it has a cellular basis, and therefore it should be treated in some ways very similar to other diseases of the body, like, as I said, the many other diseases that I describe in the book. Well, many studies have shown that early diagnosis is helpful because you can make early interventions. Those early interventions could, as I said, include familial, interventions through the family. It may involve psychiatric talk therapy. It may involve, certainly can involve medicines. So I think it's extremely important, and I think it's highly underdiagnosed, particularly underdiagnosed in the female population. And I think it's very important. I can give you one example: postpartum depression, highly underdiagnosed, very well known as a clinical entity. We're still struggling to find out what its pathophysiology is, why you get postpartum depression. We think it has to do with hormonal changes, but it's very underdiagnosed, and it can be extremely debilitating. I've seen many patients with very severe postpartum depression, almost suicidal postpartum depression, and I think it's very underdiagnosed and stigmatized. People say, "God, you've had a child. Why aren't you happy?" Well, because you've also undergone an enormous level of neurohormonal alterations and changes, and I think it's very important to recognize it. I think the whole arena of cancer nutrition has been underexplored from a scientific end. We tell cancer patients, go and eat to gain weight. We don't give them specific guidances. At Fayed, we're taking a completely different approach to this. We are thinking about nutrition as a drug. So just like you take any drug, any medicine, we're thinking about nutrition in a medical way, asking the question, what particular nutrients do cancer cells use for their metabolism? What does the cancer cell's metabolism look like? Almost 100 years ago, there was a lot of interest in cancer metabolism. Otto Warburg, the famous scientist, published a series of important papers which show that cancer cells have a different metabolism compared to normal cells. But we've never been able to exploit that difference in metabolism in a therapeutic manner. So at Fayed, we're taking a very, I would say, reductive, but a very systematic, methodical approach to figuring out what the vulnerabilities of cancer cells are and giving or creating diets that are based on this scientific approach, rather than just going and saying, you can go and eat anything, go eat, whatever you want to eat. We're trying to find a way in which we identify particular vulnerabilities of particular cancer cells and create particular diets that will act in a medical way or a therapeutic way for cancer patients. Almost certainly the diet will change with the type of cancer. So certain genetic mutations or certain types of cancer are highly dependent on certain kinds of nutrients. We've published a lot on this as a group. We've published, for instance, an important paper that shows the relationship between insulin and a particular pathway that allows cancer cells to survive and become resistant to chemotherapy and targeted chemotherapy. And we've shown in animal models, that multiple cancers, if you combine this targeted therapy, this medicine, with an insulin-lowering diet, all of a sudden this resistance goes away. So that's one of the things that we're putting into a clinical trial. Other cancers depend on certain particular micronutrients, such as proline or serine, and we are creating diets that are specifically depleted in those micronutrients so that you can, as they say in popular terminology, starve a cancer. But we are not starving the cancer. We are using very targeted, precise forms of nutritional therapy to deliver it to cancer cells. I think one of the things is that has come about quite clearly is like it or not, I think there's a very important role for mental health, for exercise in mental health. I was reminded of all of this because I was sitting down during COVID and during the COVID pandemic, not getting out of my chair, and finally I realized that I had to really sort of start exercising, if nothing else, to reduce the amount of stress that I was building up. The relationship between obesity and cancer, for instance, is another axis that a lot of people have noticed. Obesity is on the rise all across the world, but also in India. And I would say that particular interest in diet and exercise, in preventing obesity and thereby preventing cancer is something that I'm very conscious about. Well, generally speaking, cancer-related mortality at a bulk level, real changes come from prevention. That's the base of the pyramid. So there's been a lot of speculation as to what has changed. But I think some of the things that have changed, obviously smoking rates have dropped. I think there is now finally a conscious decision to lower obesity rates by changing lifestyle, behavior, and so forth. There is probably some role in cancer treatment as well. So in some particular forms of cancer, I'll give you some examples. Breast cancer, we know that there's been a combination of factors, including cancer prevention, early cancer detection and screening, and treatment, that has changed cancer mortality in the case of breast cancer. But in most cancers overall, it's prevention that really, cancer prevention that really is responsible for the most part for the decrease in mortality, cancer mortality. Yeah, in fact, I'm going to release a newer version of Improvised Melodies with updates. I was hoping to do it this year. I don't know what time I'll have, but sometime this year or at the end of this year, there will be a newer edition of the Improvised Melodies. Immunil is my pet project. It is. I have to. I'm extraordinarily proud of the work that the folks at Immunil have done. It's like sending a rocket to the moon. It's with that same sense of pride, making genetically modified T cells and infusing these T cells with astonishing data. It has just been incredible to watch. We have to finish the whole study. We released the interim reports of the study with results that are totally comparable with the European data and comparable with the data obtained in the United States. These are very, very stringent criteria. So day 90, complete response rates. So it'll be to finish the study. And then we are moving on to many, many more new cancers that we are going to try to treat with T cells, genetically modified T cells. We are creating new processes to make these T cells. We have new targets that we're looking at. So Immunil is expanding very rapidly towards looking at more and more cancers, more and more targets, finishing more and more clinical trials, and so forth. We've tried, and we are continuing to try, dozens of ways of lowering the price. There's a floor to the price because this is very complex therapy. So at a certain point of time, you can't lower price. You still have to make virus, you still have to be safe, you still have to be regulated, you still have to create a facility that's sterile, and so forth. But we are trying hundreds of ways. Our engineers are working, I would say, day in and day out to look and examine with them almost at a microscopic level every mechanism to lower the price. It's an evolving process. I absolutely think that these therapies can be made accessible. I think they have to be done intelligently. They have to be done with a lot of passion, but I think they can be accessible.